Mention China and two words pop up on your mind: lies and COVID-19. A close-up look on how Beijing is battling a fresh wave of the pandemic and the lies propagated. On Monday, China reported 47 fresh cases of COVID-19, marking the 7th straight day of cases since a domestic outbreak. The latest outbreak was linked to an elderly couple who were in a group of several tourists. They started in Shanghai before flying to Xi'an, Gansu province and Inner Mongolia. Most of the cases have been in northern and northwestern areas. Most of the cases have been reported in northern China or northwestern China, which is highly populated. China's COVID-19 tally has been on the rise since the last week. China has been the epicenter of COVID pandemic outbreak in 2019. But Beijing has been trying hard to change that narrative. So is China lying again? Despite China adopting a zero COVID-19 policy and enforcing strict measures across its provinces, why is there a rise on COVID-19 cases?
So with China opening up its borders for international tourism again, there has been an influx of tourists who have brought the Beta variant, the UK variant and the South African variant, the Gamma variant of these viruses back into the country. And this is a classic reason why there has been an increase in cases. Because remember, the vaccination is primarily based on the alpha variants, and we have to realize that with vaccination there can be breakthrough cases happening. We know that there have been over 2 billion doses of vaccines given by China, but this is a classic example that in rural areas and in areas where the vaccination may not have reached as much as it would in some of the bigger cities, there can be resurgence of cases seen. So traveling, tourism within the country, traveling between provinces, these are all the reasons why there has been a resurgence of cases.
China has everything in its capacity. If you look at the world and economies around, Beijing is doing better than most of the other countries. It has enough financial and infrastructural advancements to combat COVID-19, but no respite from the invisible enemy.
The way forward will always be universal vaccination around the globe, because we have to realize that there are many countries in the world that have only achieved 2 to 5% of vaccination for their population, and as borders open, very strictly isolated countries like Australia, New Zealand, China, which have not had much tourism or much efflux of people, are going to see these viruses and the different variants, including the Gamma, Beta, Delta, come into their country and see an increase in cases. So getting as many people vaccinated and working on a gradual reopening of economies and travel will really show us how this virus may be endemic and have small outbreaks in certain regions where the coverage is not ideal yet, or there hasn't been enough exposure, and there will require to be local containment and local measures taken to control these endemic outbreaks of the SARS-CoV-2 virus. And I think that over time, as we get more and more people vaccinated uniformly around the world, we will see less of these episodes occurring.
As of October 17, China has administered 2.27 billion doses of COVID-19 vaccines to its masses. The Wuhan Marathon, which was scheduled for 24th October, was cancelled at short notice amid worries over the coronavirus resurgence. Wuhan is the epicenter of the global pandemic, and Beijing is worried that fresh surge could again give fresh ammunition to the global community.